Hello, this is Welcome to Medicare, provided by Nebraska SHIP. Nebraska SHIP is a federally funded member of the National SHIP Network and administers the state's SMP or Senior Medicare Patrol. We are a division of the Nebraska Department of Insurance and have 7 locations to serve the state. We provide free, confidential, and unbiased Medicare education and counseling through partnerships with Area Agency on Aging offices, as well as volunteers assisting seniors. Our program office has a hotline available for Nebraskans to speak to a local representative to receive that Medicare education and counseling. Certainly, we do have a website where you can access information provided by our program, as well as publications created by CMS. Welcome to Medicare will address these topics of Medicare Part A and Part B, Medicare supplements, Medicare Part D prescription drug coverage, and Medicare Advantage plans, also known as Part C. We'll take a look at the enrollment, the cost, and the coverage. Following that, we will conclude with Medicare fraud and abuse. Before we dig into the topic of Medicare itself, there are terms that we do want to remind folks about because these terms will be something that will be encountered with your usage of your Medicare benefits. Now, certainly we're probably looking at this screen thinking, yes, we do know what these terms are, but they do warrant a recap. So briefly, Medicare certainly will have premiums depending on those decisions you make. Premiums do exist, and that is that monthly cost that we pay to have the insurance in place. Beyond premiums, other costs will include deductibles. Deductibles are those amounts that we pay before the insurance kicks in and starts paying its share of cost. Beyond deductibles, a person will of course encounter co-pays or co-payments, as well as co-insurance. The simple difference between the two, co-pays are going to be set dollar values usually, whereas co-insurance are a percentage of full cost. Beyond those quick terms, we do want to remind folks that an out-of-pocket maximum is something that you will potentially encounter depending on decisions that you make. And certainly an out-of-pocket maximum is just simply referring to that amount that you would pay before your spending ends and the insurance takes over for the rest of the calendar year. So what is Medicare? Definitely can be a confusing topic. Fortunately, the Nebraska SHIP, we make it easier. To put it simply, Medicare is federal health insurance. It was created in 1965, signed into law by President Lyndon Johnson. Now, when Medicare was initially available, it was only provided to those individuals who were age 65 years of age or older. It wasn't until 1972 that Medicare was expanded to provide coverage for these other 2 groups of individuals, those folks who might be younger than 65 with a qualifying disability, or those individuals with end-stage renal disease. Basically, in order to qualify for Medicare, a person simply needs to fit into one of these 3 categories. Now, when a person qualifies for Medicare, they will need to determine how they want to receive their Medicare benefits. Here, we're offering a visual of those 2 options that a person typically has, Original Medicare or Medicare Advantage. Visually, we see Original Medicare can potentially be comprised of 4 individual parts, whereas Medicare Advantage is going to be a packaged option. We're going to go ahead and take a look at these 2 options. We will begin with Medicare Part A and Medicare Part B. Medicare Part A serves as hospital insurance, and it pays for these 4 items listed on the screen: inpatient hospital care, skilled nursing facility care, home health care, and hospice. Now, when we see skilled nursing facility care, please do not confuse that with that move into a nursing home. Medicare, like most insurance, does not cover long-term care cost. So, when we see skilled nursing, think of that more along the lines of a rehab stay. Perhaps an individual is receiving physical therapy or speech therapy. Now, Medicare Part A will typically be premium free for most individuals. This is because Medicare Part A is paid for through 10 years of employment paying Social Security Medicare taxes. So, although premium free, Medicare Part A does have cost associated with its usage. Now, in the event of a person is hospitalized as an inpatient, they will see a deductible of $1,556. What their deductible is paying for is the first 60 days of hospitalization. In the event a person requires care beyond 60 days, they do have access up to 150 days with a daily copay starting on day 61. Now, in the event a person requires skilled nursing facility care, we do see that Medicare Part A does cover the first 20 days at 100%. Beyond that, if a person requires care, they do have access up to 100 days with a daily copay at $194.50 per day. Now, Medicare Part B medical insurance, this is the part of Medicare that's basically covering everything else outpatient. It's covering the doctor's visit, lab work, x-rays, medical equipment, and it's of course covering most preventative benefits as well. Now, Medicare Part B does have a monthly premium. That standard premium this year is $170.10. Now, individuals who may have a higher income could potentially see an IRMA or income related monthly adjustment amount. As we see on the slide, the IRMA is imposed on individuals who file an income tax return at 91,000 or higher, or a couple filing a tax return at 182,000 or higher. Specifically, those amounts are the person's modified adjusted gross income. Certainly, you can speak with a tax professional to learn more about that if necessary. Now, regarding other costs, Medicare Part B does have a one-time annual deductible. That amount this year is $233. Once a person has met that annual deductible, they will then start sharing their cost with Medicare at an 80-20 split. Certainly, Medicare will be covering the 80% share. The 20% share left over for the individual does not have an out-of-pocket maximum. So, when and where does a person sign up for Medicare Part A or Part B? Let's first address those individuals who are receiving Social Security or railroad retirement benefits before the age of 65. Now, in the event that a person elects to receive those benefits before 65, it is that group of individuals who are automatically enrolled into both Part A and Part B. These individuals will typically see that red, white, and blue Medicare card about 2 to 3 months before that Medicare begins. Now, there will be instructions included with that Medicare card in the event that a person wants to defer the Medicare Part B medical insurance. Certainly, they will be required to maintain enrollment into Medicare Part A because Part A is a requirement when when an individual is receiving Social Security or railroad retirement benefits. Now, those folks who are not receiving those benefits, they will need to sign themselves up if they desire the Medicare to begin at Medicare eligibility. So, when a person is Medicare eligible based on age, they will have that initial enrollment period available, and that 7-month period surrounds that 65th birth month. A person is able to enroll into Medicare in one of those 3 months leading up to the 65th birth month, or in one of those 3 months after the birth month. Now, as far as the actual enrollment process is concerned, there are typically three ways that a person can do this enrollment. They can contact the local Social Security Administration, they can do enrollment over the phone, or the easier and faster way, most likely, is doing the enrollment process online at Social Security's website, ssa.gov. Now, in the event that you elect to do your enrollment online at Social Security's website, do note that you will need to have a My Social Security account established prior to executing enrollment into Medicare. One thing to note with that application process, it is initially enrollment into Part A itself. During the application, there will be a question that you will need to address, and that question is going to ask whether or not you want Medicare Part B medical. You will answer appropriately based on what you desire. Now, what if an individual is still working? Do they need to enroll into Medicare? Now, because there is a lot of misinformation that surrounds this particular topic, I find that I typically read this slide verbatim, at least initially, and that does read: if you or your spouse are currently working and you receive your healthcare coverage from active employment, you are not required to enroll into Medicare at age 65. Let's go ahead and elaborate on this just a tad. Now, this rule is specific for large employers, those employers that have 20 or more employees. So, in the event that you are actively employed, or perhaps your spouse is actively employed, and insurance is being received from that employment, enrollment into Medicare may not be necessary. Now, a lot of folks do choose to enroll into just the Medicare Part A. Certainly, that is a decision that you can make. In the event that you do, note that the Part A will act as a secondary payer to the group health insurance. Now, if a person has a health savings account that's paired with a high deductible health plan, enrollment into Medicare is something that you will need to think about, because contributions into the HSA cannot be done when a person is enrolled into the Medicare program. So if you have more questions about that, you can certainly reach out to the HSA organizer. In the event that a person is insured beyond age 65 from group health insurance, the individual at retirement or spouse's retirement will have a special enrollment period. Basically, special enrollment allows a person to elect their Medicare coverage anytime while still covered by the group health plan, up to 8 months after the loss of that insurance. At this point, what's being suggested is that if a person does anticipate retirement, they should execute enrollment into Medicare Part A or Part B, usually 2 or 3 months before they want Medicare to begin. This will allow Social Security Administration to process paperwork and get a Medicare card sent to that individual in a timely manner. Now, in the event that a person does not enroll during their initial enrollment period or during a special enrollment period, the only other opportunity to enroll into Part A or Part B is during the general enrollment period, which begins every year on January 1st and ends on March 31st. In the event that a person enrolls during this time, they will see coverage begin on July 1st, and this is typically when a person will encounter penalties. So this slide is providing you a visual of a tool that Nebraska SHIP provides for you to better understand when Medicare will potentially begin in relation to that initial enrollment period. Remember that we said that if you enroll in those months after, there is a delay. And so that's where the development of this tool came in, because there is some confusion surrounding that, and there is a potential that a person may have a gap in their insurance. So when we look at this example, what we see is that the individual is turning 65 in the month of April. So with that scenario, the individual who turns 65 in April can enroll into their Medicare to begin April 1st, anytime in the month of January, February, or March. We do see coverage begins that month. Now, in the event that a person elects enrollment into Medicare Part A or Part B in their 65th birth month, the coverage is delayed to the first of the next month. In this scenario, May 1st. If this person were to elect their Medicare in that month of May, the first month after turning 65, we do see there's that delay in coverage. The coverage would not begin until July 1st. We see that there's a gap there. June is not available for Medicare to begin. Now, in the event that a person takes the enrollment into Medicare in the month of June or in the month of July, we do see that delay in coverage. Again, September or October would then be those effective dates in the event that a person enrolled in that second or third month after turning age 65. Now, once that person gets out of the initial enrollment period, in this example, August is that fourth month after turning 65, we see that that person has that ability to enroll with coverage beginning the first of the next month. Definitely note that the initial enrollment period rules will supersede all other rules, and definitely it's important to note that fact, because if a person is looking at retirement around the same time as turning 65, there is this potential of a gap in the person's healthcare coverage that they need to be aware of based on the timing of the enrollment itself. Now, before we move on to the Medicare supplement topic, the final point to make about Medicare Part B is the fact that there is a Medicare savings program available to assist individuals who may have limited income or limited resources. Essentially, the Medicare savings program will help an individual with the Medicare Part B premium. Now, as we can see on the screen, the income and asset requirements listed do indicate a person with, definitely limited resources, and an individual who potentially feels as if they want to apply for this can certainly do so through Access Nebraska, a division of the Nebraska Department of Health and Human Services. So we just want folks to be aware that this program exists. It exists to help folks stay healthy, and it does help a number of Nebraskans. So just keep this in mind in case you are able to share this information with someone else. Okay, so let's go ahead and move on to the next topic, being Medicare supplements, also sometimes called Medigap policies. Now, what a Medicare supplement is it is an optional extra piece of insurance that a person with Medicare can purchase in the event that they choose to do so. What Medicare supplements do is they work to pay the individual's out-of-pocket cost after using Medicare Part A and or Medicare Part B. Now, supplements will be purchased from a private insurance company. And because of that, Medicare has put into place some protections to ensure that everyone is treated fairly, essentially. And one of those protections is the standardization of the Medicare supplements. What that basically means is that the coverage that a purchase, the coverage that a person purchases will be the same exact coverage from any other option selling that type of policy. Basically, if we're looking at a Plan G from one entity, it is the same exact Plan G from a different entity. So standardization means that the companies are selling the same exact coverage. Now, another thing that standardization does is it makes these plans guaranteed renewable, simply meaning as long as you pay your plan's premium, you are a member of that, and it is your policy to use. So certainly Medicare supplements are purchased from the private insurance companies. There are rules in place to help protect you as the consumer. Now, this slide is giving you a visual of the different levels of coverage that are available with Medicare supplements. Basically, this matrix is indicating that there are basically 8 different options that a person may choose from at this point. When we look at Medicare supplements, these first 6 line items above this dark black line in the middle, those 6 line items listed above, those are basic required benefits, meaning any insurance company that is selling a policy, a Medicare supplement policy, they must, of course, sell Medicare Supplement Plan A. Beyond that, they do get to determine what other supplement plans they want to sell. And one thing to point out, please do not make a very common mistake and confuse Plan A, Plan B, Plan D with Medicare's Part A, Part B, Part D. Medicare created an alphabet soup here. We will swim through that soup and note that when we talk about plan, we're talking about the Medicare supplement, that subset within Medicare overall. So again, Plan A covers 6 basic required benefits. Beyond that, companies can determine if they want to sell these policies that offer additional benefits, these other line items listed below that black line. Now, we do see Plan G does provide 4 additional check marks, the most amount of additional benefit coverage available from a Medicare supplement. So when we're looking at Medicare supplements, essentially what you're looking at is the ability to choose the level of coverage that seems most appropriate for individual needs, and certainly recognize that cost will potentially fluctuate based on the level of coverage that is chosen. Now, regarding cost, definitely premiums can see a wide range of potential starting cost. And we are seeing on the slide a premium range of between $30 up to $560 per month. So definitely a significant range. Essentially, what determines the cost of that premium will be the entity that sells it, certainly. But when we're looking at $30 premiums, most likely what you're looking at there is potentially a Plan K. The previous slide indicated that Plan K supplement does cover half the cost for some line items, leaving an individual with some potential out-of-pocket cost risk with an out-of-pocket maximum. So those types of plans that offer that type of coverage will potentially come with lower premiums. I did indicate that there's essentially 8 different plans to choose from. If you include the high deductible Plan G option, that in fact would be a 9th option, and a high deductible G would potentially fetch a lower premium, probably on this lower premium estimate of roughly $30 to maybe $50, $60 per month. When we look at supplement premiums that are above a certain value, these significant rates at around $400-500 per month, what we're looking at there is an example of cost when a person is shopping outside of their 6-month window of guarantee issue. Underwriting is going to be a factor for supplement shopping after a certain period, and the example of $560 per month is an example of what is potentially charged for a supplement after a certain point. So the couple of examples that we see here, the first example is indicating company X is selling both the plan A and a plan G. As I indicated on the previous slide, plan A covers the fewest benefits, the basic required benefits. So naturally, we would assume that the premium cost of that type of policy would be less than a policy offering more benefits. In this example, Plan G offering the most. So definitely, again, companies can sell more than just the Plan A, and typically you would expect other policies to potentially cost more as those additional benefits are added. Now, the second cost example is just a reminder of that standardization of the Medicare supplement policies. Company Y versus Company Z in this case, they are both selling a supplement plan G, one at $103 per month, the other at $228 per month. Now, regardless of the difference in cost, these two companies are selling the same exact coverage. You do not get anything more, you do not get anything less for the premium you paid. Remember, the coverage is standardized. Well, let's go ahead and elaborate on that guarantee issue period that I alluded to previously. Now, when a person becomes Medicare eligible, and if that person signs up for Medicare Part B medical insurance, what they also are doing is they are activating a 6-month window of guarantee issue for the purchase of a Medicare supplement. Essentially, what that means is that within the first 6 months of starting Medicare Part B, an individual is guaranteed a Medicare supplement regardless of current or pre-existing conditions. Now, anytime after that 6-month window, a person certainly has the option to shop around. As a consumer, that is your right. And certainly you may find that shopping around could potentially result in lower premiums. Now, remember, you do have the right to shop around, but underwriting will be a part of that shopping experience. Underwriting, of course, is the process where you would answer questions about health and history. Depending on the answers provided, the insurance company gets to evaluate those answers and determine whether or not to offer a policy. And if so, if they are offering that policy, they do get to determine what premium will be charged for that. So basically, underwriting, they're figuring out what type of risk you're posing to them. And if they decide to offer a policy, it is going to be based on the potential risk factors that you present from the underwriting. So very important. The biggest takeaway from this particular topic is potentially this information, and that is the fact that you do have a 6-month window in which an insurance company is required to sell a policy at its lowest advertised rate. So keep that in mind if you are interested in a Medicare supplement. And this is especially important to consider, especially if a person is automatically enrolled into both Part A and Part B. Potentially a person is needing to send that Medicare card back, deferring Part B in order to preserve this 6-month window of guarantee issue in the event that that person perhaps has insurance from another source. We've already discussed that. So these are definitely details to keep in mind. All right, so beyond that, how does a person determine what supplement options are available? Now, instead of going online and doing a search engine review of every Medicare supplement company in the area, instead, what you have available is this resource provided through Nebraska SHIP. With the very basic information of your zip code, age, gender, tobacco status, and which of those supplement plans you're interested in, our program office will provide you a full listing of every single supplement option that is licensed to sell within the area. What that information will include is the name of the company. It will indicate the premium that they are charging to start out, and you'll get a look at premiums moving into the future about 4 years out. You're also going to get some information regarding the plan's activity in the past, regarding potential increases or decreases to premiums. You're also going to see some market data information and whether or not the company is rated by the AM Best or S&P. So with this information, you're going to be able to evaluate every option licensed to sell within your area. And what's so great about the information is you're not having to provide your contact information to individual entities. This will essentially negate that need to have your contact information distributed more than you would potentially like. So reach out to the Nebraska SHIP for this very useful information. It is yours for the asking. Okay, moving on to Medicare Part D prescription drug coverage. Medicare Part D drug insurance was introduced in 2006. What it exists to do is to help with brand name and generic prescription drugs. Part D does not cover over-the-counter medications. It does not cover most vitamins or supplements. So again, brand or generic prescriptions is what this insurance is designed to cover. In Nebraska this year, we do have 22 plans to choose from with a monthly premium ranging between $6.80 up to $116.10 per month. Now, this part of Medicare can also potentially see a person pay an IRMA, that income-related monthly adjustment amount. If a person has a higher income, the drug plan will send notification to that individual communicating what that additional IRMA premium will be. Now, one thing I didn't mention previously is the fact that IRMA is something that can be appealed. A person has that right to ask Medicare, or in this case, the drug plan, to take a second look. Perhaps a person has experienced a life-changing event that would qualify them for a reduction or elimination of the IRMA. So note that that is an option, not only here in Part D, but in that previous topic of Part B medical. Now, moving on from the premium, deductibles can exist. In Nebraska, majority of our plans do carry the maximum deductible allowed at $480. Now, there are some plans that do have a zero deductible, but those premiums typically will start around that $70 value or higher. So there is that trade-off definitely to get that zero deductible. Now, beyond premiums and deductibles, Medicare drug coverage will also see a person encounter potentially both co-pays and co-insurance. Co-pays can range anywhere from $0 to certainly a set dollar value, depending on the tier level. That is higher than that amount, of course, or a full percentage of cost, seen as that co-insurance. In some cases, up to 50% of the full cost of a prescription. So what we're seeing here essentially is that Part D prescription drug cost can accrue quite rapidly with its usage. And unfortunately, there is no supplement for this option. Any drug expense will be your responsibility. So, with 22 prescription drug plans in Nebraska, how does a person actually decide which prescription drug plan to enroll into? Well, basically, that decision is going to be based on the actual drugs that the individual takes, assuming they take prescriptions. In the event that a person does not take prescription medications and they're enrolling into Medicare, they're most likely probably going to go ahead and enroll into the lowest premium plan available to satisfy that need of having Part D drug insurance in place. And of course, having that insurance in place would, of course, avoid any potential accrual of penalty. So, in the event that a person does take prescriptions, like I said, those drugs should be the determining factor. The way these plans work is they have a formulary, fancy word for drug list. Essentially, they organize the plan's formulary by tiering system, tier 1 through maybe tier 5 or 6, depending on the plan. Those lower tiers are typically your low-cost generics. As you climb those tiered levels, you're getting into those more expensive brand name drugs or specialty drugs. Now, certainly the pharmacy that you use will also have an effect on your out-of-pocket cost. These plans do have networks, and within those plan networks, they do have different pharmacy status for the network participants. You will potentially find a plan will have preferred pharmacies versus standard pharmacies. Simple difference between the two, a preferred pharmacy more often than not should fetch the individual lower preferred pricing for drugs, whereas a standard pharmacy, although it can be used, potentially a person using a standard pharmacy may be paying more than they need to for their prescriptions. So you do have these choices, and certainly these are variables to take into consideration when you are determining the Part D option to enroll into. Regarding enrollment, when and where should a person do this? Well, we're kind of seeing a theme here. Basically, with Medicare Part D, a person has that ability to enroll during their initial enrollment period when they're first eligible at age 65, or perhaps younger than 65, qualifying based on disability. Certainly beyond the initial enrollment period, if that person is older than 65 and they decide to continue to work, then they would have that special enrollment period at retirement. But do note that special enrollment periods can be created through other life-changing events. Perhaps the change in residency occurs. That would actually open up a special enrollment period for a person in the event that they moved outside of their plan's coverage area, or they moved into an area that had additional options that were not available in the previous location. Now, as far as signing up itself, a person can execute that process on Medicare.gov. They can contact Nebraska SHIP and work with a SHIP representative to do this, or they can, of course, work directly with an agent or individual that represents a plan. So there are a number of options available. If you like to do things yourself, Medicare.gov is where you would go for that. If you would like some unbiased assistance in this process, the Nebraska SHIP office is definitely happy to help. Okay, final point to make about Medicare Part D is the fact that Medicare Part D also has an assistance program known as Extra Help. Extra Help is administered by the Social Security Administration, and what it exists to do is to help individuals with limited income or resources better afford prescription drug costs. Essentially, if a person qualifies for extra help, depending on the level of subsidy they qualify for, the individual could potentially see a reduced premium and a reduced deductible, potentially reduced to the amount of zero in some cases. The extra help will also help control the copay or co-insurance values that the individual pays when they get their prescriptions. Again, administered by Social Security Administration, applications can be completed through their office or through the Nebraska SHIP office. We're simply sharing this information again in an effort to make sure that people are aware that these programs exist, and certainly again they exist to help keep people healthy. Extra help helps a number of Nebraskans, and we want you to be able to share this information in the event that you know somebody who could use this type of assistance. So just keep it in mind and note that it is a program that helps a lot of folks. Now, to recap overall potential premium cost, original Medicare, if all four parts are elected, an individual could potentially see premiums anywhere between roughly $300 to about $350 per month. Again, Medicare Part A, premium free should be for most folks. Part B, that standard premium this year is the 170.10. The supplement and the Part D, those are going to be the parts of the original Medicare that will be that variable depending on decisions made concerning those options. So we basically want a person to anticipate potential premium costs at roughly $300 to about $350 starting out. And do note that these premiums are per individual. Remember, Medicare is individual insurance, and this is an individual potential cost. Okay, moving on to Medicare Advantage, also sometimes called Medicare Part C. What Medicare Advantage is it is the alternative to original Medicare. Now, I'm going to stress this point. Please note that Medicare Advantage is not a Medicare supplement. It does not work in addition or on top of original Medicare. In the event that you elect Medicare Advantage, you are effectively electing to have your Medicare managed by the private entity that manages the Advantage plan that you enroll into. So again, not a supplement. It is not in addition or on top of. It is an alternative. You will be required to have both Part A and Part B before you can enroll into a Medicare Advantage plan. What the Advantage plan does is typically combines, it typically combines the Medicare Part A, the Medicare Part B, and usually the Part D drug coverage into one package. It is required to offer equal or better coverage than that provided by original Medicare, and typically the better is coming from the inclusion of these extras, that potential dental, vision, or hearing benefit. Why these are extras is because original Medicare does not offer routine coverage of dental or vision. Certainly, original Medicare would cover vision in the event of medical necessity. Perhaps the individual has glaucoma or cataracts. That would be a medically necessary instance where Medicare would cover vision needs. But if a person were simply needing routine vision because they require glasses to legally drive, Medicare doesn't pay for that. It's not medical necessity. So the Medicare Advantage plan has decided to offer that additional benefit, again, as that enticement. Now, regarding this option in Nebraska, unfortunately, it is not available within every county. There are, in fact, 5 counties in our state that do not have this option. And as we can see, those counties include Brown, Cherry, Kimball, Richardson, and Sioux. So anyone who resides within these 5 counties, they do not have Medicare Advantage as an option at this point. Their decision is simply, or their option basically is simply Original Medicare. Now, that said, we do anticipate the Advantage Plan option to continue to grow within the state of Nebraska, as it has done in the previous years. At one point, there were 34 counties that did not have this option. That was just a couple of years back. Since then, we have seen the Advantage Plan option grow within the state of Nebraska, and it is available within most parts of the state, except again for these 5 counties. When we take a look at cost of Medicare Advantage plans, people should keep in mind that because they will have both Part A and Part B, they will continue to pay their Medicare Part B premium. And potentially they may see an additional premium from the Medicare Advantage plan, depending on, of course, the plan itself. So in Nebraska, we do see Advantage plans that do not charge an additional premium, and we do see plans that do charge additional premiums, one as much as $125 per month, in addition to the standard Part B premium. Now, of course, other costs do exist with the Advantage Plan option. A person could encounter both a health deductible as well as a prescription deductible. Because the Advantage Plan is providing prescription drug coverage, if it chooses to, it will be required to follow those same rules set forth for Medicare Part D. Thus, the reason why we see that same maximum deductible of $480. Now, with the usage of Medicare Advantage plans, a person will potentially encounter both copays and co-insurance, whether it's from the prescription drug use, the usage of the prescription drug coverage, or perhaps it's usage of hospital or medical services. Each plan is going to structure how it wants to, and again, copays or co-insurance will be encountered with its use. Now, because Medicare Advantage does not work with Medicare supplements, what a person is provided instead is a potential out-of-pocket maximum. Now, within the state of Nebraska, that maximum sits between $3,000 up to $11,300. Basically, what this means is if a person were to see a higher usage of their insurance, they will potentially see their spending end if they hit the out-of-pocket maximum defined by the Advantage Plan. Now, regarding the costs that apply towards that maximum, typically it's going to be usage of hospital or medical services. Any dollars spent on prescription drugs or the extra benefits will not apply toward this out-of-pocket maximum. Now, when we're looking at enrollment into a Medicare Advantage plan, again, we're seeing this theme. Enrollment at first eligibility, age 65, during the initial enrollment period. If working beyond 65, the individual has a special enrollment period available. Like we stated with Part D, changes in residency or other life-changing events could potentially open up a special enrollment period. As far as executing enrollment, a person can do that themselves through Medicare.gov. They can work with an unbiased representative through Nebraska SHIP, or certainly they may work with a licensed representative of the plan that they are choosing to enroll into. So a couple of different options. Definitely it's up to you how to proceed in that enrollment, but again, you're doing it again usually during the initial enrollment period if not insured by active employment, or potentially during a special enrollment if working beyond initial Medicare eligibility. Okay, so to recap potential premium and cost of Medicare Advantage, again, a person will of course be enrolled into both Part A and Part B, continue to pay that standard Part B premium. Some Medicare Advantage plans do charge an additional premium. In this cost example, we are showing a plan that does charge an additional premium of $26 per month. So definitely this option can present a lower premium cost option. In this example, 196.10 is definitely less than that previous example of original Medicare at roughly $350. So when we're looking at the differences between these two options, premium cost is something to take into consideration. Beyond premiums, though, remember that usage is something that also should be considered. In the event that a person has higher usage of their insurance, potentially pre-existing or current conditions require them to use insurance more often than not, a person in that situation could potentially find original Medicare with a supplement to be more cost effective. Whereas a person with lower usage of insurance, perhaps they're healthy and don't utilize health insurance that often, if ever, perhaps Medicare Advantage will be a more cost-effective route for that individual. Remember, Medicare is individual insurance. You will need to make this decision based on your individual needs. It is possible that if you and your spouse are retiring and enrolling into Medicare at the same time, it is possible that one of you may choose original Medicare and the other chooses Medicare Advantage. It is definitely something that we have seen. And again, just a reminder, it is individual insurance. You're going to want to make this decision based on what you feel is the most appropriate for yourself. Okay, so that brings us to our final topic, and that topic is Medicare fraud and abuse. Now, the reason why we want to take a few minutes to discuss this topic is one of the reasons is that dollar value you see listed on the screen. Medicare does see a estimated loss of roughly $60 billion annually. Now, that estimate was first provided back in 2014 and unfortunately has been a consistent estimate of loss from the Medicare program each year up until this very current year. So fraud and abuse, it happens, and certainly potential reasons for fraud could be provider billing for services a person never received. An example of abuse could be a provider prescribing services that are not necessary. But definitely fraud and abuse can happen from other activity, perhaps compromised Medicare information. Now, with this loss, we do see that this will potentially have a long-term effect on the Medicare program. Certainly, tax dollars are being lost, putting the Medicare fund at risk, meaning potentially there may be less money for benefits or a higher cost for the Medicare program moving into the future. Now, of course, human error does exist. Most providers are honest, and usually an error is simply an error. Definitely the only way to determine if something is legitimate or not is through review and investigation. So here at the Nebraska SHIP office, remember we administered the SMP, the Senior Medicare Patrol. Basically, that side of our office is focused on fraud prevention through communication and, of course, serving as a source to report fraud. So what we ask folks to do are these three things. We want you to protect, detect, and report. Now, when we say protect, basically what we're saying there is please do not share your Medicare number or any other personal information with anyone requesting it, especially if they're calling you over the phone and asking for that information. Remember, Medicare, like other government agencies, does not cold call you. Medicare would only contact you in the event that you initiate that contact first. Now, in some limited situations, Medicare may call a person to conduct a survey. However, before that call is made, the individual receives a letter stating that that call is scheduled and that they request that the individual be available. So again, Medicare does not cold call you. If you receive a phone call from somebody purporting to be from Medicare, maybe they have a couple of pieces of information on you, please do not engage. It is okay to hang up. Like we say in our office, it's okay to be rude. Remember that these scammers are clever and they do have different ways of getting information to be able to move into fraudulent activity once they have obtained enough information to be able to do that. So the second tip of detect, what we're asking you to do there is to utilize resources that Medicare provides to you after the use of the Medicare benefit. So if you use your Part A or Part B, you will receive a Medicare summary notice. The Medicare summary notice is not a bill, and what it does is it highlights what was paid for on your behalf through the Medicare program. Certainly, if you utilize a Medicare supplement or prescription drug plan or enroll into one of those Advantage plans, you will receive an explanation of benefits from those options. Much like the MSN, it is outlining what was paid for on your behalf. What we ask folks to do is to keep records, keep a healthcare journal, any billing information from the entity, so that you have this information to compare to the MSN or the EOB. Basically, what you're looking for is you're looking for billing for services you did not receive. You're looking for billing. You're looking for billing for services more than once. You're looking for billing for services from a doctor that perhaps you never saw. If you find something questionable, report it. Ask questions. Call that provider first and inquire about that particular line item. Perhaps it's just human error or it's something that can be explained. Beyond that, if you do have a conversation with a provider and you're not satisfied with the outcome of that conversation, you can call the Nebraska SHIP office. Remember, we administer SMP and we do serve as a resource to determine whether or not activity is in fact fraudulent, and if so, we can help report it to the appropriate entity. Okay, so regardless of your decision, whether it's original Medicare with a supplement and Part D plan, or you decide to enroll into a Medicare Advantage plan, remember that you do have an annual opportunity to evaluate options for the next calendar year. That annual opportunity begins every October 15th and runs through December 7th. It's during that time that you can work with a Nebraska SHIP counselor or do the research yourself to determine the best coverage and elect the lowest cost. As you can see, in the year 2020, Nebraska SHIP helped save Nebraskans with Medicare over $17 million. Of that $17 million, over $8 million was specific to prescription drug cost. So just keep it in mind. The annual open enrollment is a very important time for you to secure the best coverage at the lowest cost for the next calendar year. Okay, so final point. Nebraska SHIP, we're here to help. Remember that we are able to provide Medicare education over the phone, in person, or through an online resource, Cisco WebEx in this case. We'll help you compare cost for those Advantage plans, drug plans, or supplements. If you have questions about enrollment, or perhaps you're already enrolled and you run into a billing problem and think Medicare is in fact responsible, but they're saying they're not, Nebraska SHIP, we can help with that. We also help you in that fraud education and prevention and serve as a source to report potential activity. Remember that we also do provide education throughout the state, and if you know somebody who could use this type of education, be sure to share our contact information. We are available through our statewide hotline at 1-800-234-7119 or at our website. So definitely take a look and note that you have a partner in the community that can make this topic of Medicare an easier transition. Thanks a lot for watching. I do appreciate your time, and hopefully we get to have a conversation with you in the future. Thanks a lot, folks. Goodbye.